Namaste to all. Welcome to yet another session of Easy Ayurveda Gurukula. So today we have a guest speaker with us, Dr. Ashwin.
Okay.
I have the privilege of introducing our guest speaker, Dr. Ashwin. So Dr. Ashwin works as medical officer at the prestigious Sridharayam Ayurvedic Eye Hospital and Research Center. So we all know at Kuttathukulam in Kerala. So he is also in charge of Sridharayam Mobile Clinic and has rich resource of knowledge regarding eye disorders and their management. So he has completed his BMS from ENPS Ayurvedic Medical College, Kerala, and post-graduation in Kai Chikitsa from AL and Rao Ayurvedic Medical College, Kopa. So this is a brief introduction of our guest speaker, Dr. Ashwin. Dr. Ashwin will be speaking on the topic Ayurveda management of dry eye syndrome.
Good evening to all. Today I will be dealing a small session on dry eye syndrome. So straight away I'm going with the slides. Today's our topic is dry eye syndrome. Usually dryness can be because of many factors. As such, dryness is not a common disease. It may be results of some other external factors like some other disease or some of our daily habits may lead to dryness. We will be dealing with all those things today. Let's start the session. Before explaining about the dryness, first I have to tell you a brief introduction about tear film. Tear film is responsible for providing a smooth refractive surface for our clear vision. So, structure of tear film. Eugene Gould was the first to describe the detailed structure of the fluid covering the cornea and call it precorneal film. It basically consists of three layers: mucus layer, aqueous layer, and lipid or oily layer. First one is the mucus layer. It is the innermost layer and it consists of mucin secreted by conjunctival goblet cells and glands of man. The middle layer is the aqueous layer. The bulk of tear film is formed by this intermediate layer, which consists of tears secreted by the main and accessory lacrimal glands. The tears mainly comprise of water and small quantities of solutes such as sodium chloride, sugar, urea, and proteins. Therefore, it is alkaline and salty in taste. The third layer is the lipid or oily layer. It is the outermost and thinnest layer of the tear film, formed at air-tear interface from the secretions of Meibomian, Zeiss, and mole glands. This layer prevents the overflow of tears, retards their evaporation, and lubricates the eyelids as they slide over the surface of the globe. Now, coming to the functions of tear film, why the tear film is necessary? It keeps moist the cornea and conjunctiva, provides oxygen to the corneal epithelium, washes away debris and noxious irritants, prevents infection due to presence of antibacterial substances, facilitates movement of the lids over the globe. So these are the basic functions of tear film. Now, what is dry eye disease? Dry eye disease is a condition caused by many factors that results in inflammation of the eye and tear-producing glands. Inflammation can decrease the ability of the eye to produce normal tears that protect the surface of the eye and keep it moist and lubricated. Definition: in 2007, the International Dry Eye Workshop defined it as a multifactorial disease of the tears and ocular surface that results in symptoms of discomfort, visual disturbance, and tear film instability with potential damage to the ocular surface. It is accompanied by increased osmolarity of the tear film and inflammation of the ocular surface. So, how the dry eye affects the quality of life? Okay, so there are multiple factors in dry eye. One is the transient discomfort. Next is maybe stimulated by environmental conditions, inflammation and ocular surface damage, and there will be altered tear film composition. Now, role of inflammation in chronic dry eye. Inflammation may be present but not clinically apparent. Cycle of inflammation and dysfunction, and if untreated, this inflammation can damage lacrimal gland and ocular surface. Consequences being lower tear production and altered corneal barrier function. Who is likely to have dry eye and how do we diagnose it? So mostly it's commonly seen in elderly women or in post-menopausal state or patients who are taking glaucoma medications. Glaucoma is a condition where there is increased IOP, intraocular pressure, or else it also results in the contact lens users, or working for long hours in front of computer, or if we are continuously sitting in an air conditioned environment, then also there is a chance of development of dryness. Now, patient types with a high incidence of dry eye disease: women aged 50 or older, women using postmenopausal hormonal replacement therapy, and some other ocular comorbidities. Those with ocular comorbidities like xerophthalmia, cicatricial pemphigoid, atopic keratoconjunctivitis, etc. Or people who are using contact lenses, especially those who use contact lens for a prolonged period, and smokers. Now, predisposing factors of the dry eye disease: aging, then in the decreased androgens in menopause due to this allergic responses, as already mentioned in contact lens wearer, and in low humidity, it can be heating or air condition because of lack of sleep, use of computer terminals, environmental stresses like wind, air pollution, ocular surgery like LASIK, corneal transplant, and due to some medications. Thing is that dryness, we cannot take it as a complete disease. It may arise because of multiple reasons, most of them being as a byproduct of some other disease conditions. As I told, because if you are a glaucoma patient and you are continuously using anti-glaucoma drops, then there is a chance of developing dryness in the eyes. Medications that may contribute to dry eye disease. So these are some medications which, if the patient is using continuously, then they have the chance of developing dryness. Systemic like antihypertensives, anti-androgens, anticholinergics, antidepressant, cardiac, antiarrhythmic drugs, Parkinson's disease agent, antihistamines, and topicals like preservatives in the tears. Now, due to some of the autoimmune condition, there also can be dryness, like systemic autoimmunity, rheumatoid arthritis, lupus, Sjogren's syndrome, graft versus host disease. All can result in immune-mediated inflammation in the eye. Inflammatory mediators secreted into tears and promote inflammation of ocular surface. For example, if we are taking here as a Sjogren's syndrome, the patient will be having dryness in the eyes, as well as he may be having severe dryness in his mouth also. So that kind of condition is called as Sjogren's syndrome. But here we have to see that we should not directly go with a simple dry eye treatment. For the symptomatic purpose, we can give medications for the dryness in the eyes, as well as for general health condition should also be noted. Dry eye disease symptoms. So these are the common symptoms which we will be seeing for a patient with a dry eye. There will be discomfort in the eyes, dryness, obviously, then burning and stinging, foreign body sensation. Like sometimes the patient will be telling that he or she may be feeling that something like sand fell inside his eyes. Such kind of feeling they will be feeling. Then gritty feeling, stickiness, blurry vision, photophobia, especially while going out and all, the patient feels difficulty in seeing the sunlight. And there will be sometimes watering from the eyes also, itching, redness. So here is a clinical presentation that can vary in severity also. So slit lamp is a examination tool for viewing the eye. Here you can see in the mild cases how it may be, and in severe cases how the eye looks in the slit lamp. Second is also like the fluorescent dye stain. Here also mild case, what will be the structure, and in the severe case how it looks. Next, sometimes there will be filaments, comma-shaped structures over corneal surface which moves on blinking. So this kind of feature we can see in a patient's eye when we are seeing through ophthalmoscope or slit lamp kind of equipments. Then in the bulbar conjunctival vessels may be dilated like red eye, and in the corneal surface there will be irregularity, dry areas we can see in the corneal surface. Blinking, it can be incomplete or infrequent. Mostly they will be going on blinking the eyes, and some patients will be continuously rubbing their eyes. Such kind of features we can generally see in the dry eye condition. And Meibomian gland dysfunction and blepharitis. In all these conditions, also there is a chance of development of dryness. So these are the basic diagnostic tests which we use to diagnose for the dry eye condition. Many tests you can see. The most commonly used one is the Schirmer test, which you can see on the left side of the screen. So here in the shimmer test, this is the shimmer strip. So we will the bend end of the test strip is placed in the eye such that it rests between the palpebral conjunctiva of the lower eyelid and bulbar conjunctiva of eye. And how this test is done is we have to see, we can see the some scales, how much wetting is being noted in that reading. That is the purpose of this test. Like it will be kept, the bend end of the test strip is placed in the eye such that rests between the palpebral conjunctiva of lower eyelid and bulbar conjunctiva of the eye. So purpose is to measure the basal secretion by eliminating the reflex tearing. Eye should not be manipulated before the test. So once we are keeping this strip, as I mentioned already, so we will be keeping that for 1.5 minute time, and we will be noting to what level the strip is got wet. Normal wetting like 10 to 15 means it's normal. Usually, a normal person will have the wetting like it will be sometimes 25, 30 and all. But in dry eye condition, we can usually see between the 9 to 14 means it's like mild dry, and moderate is 4 to 8 That means the strip you can see there. So 9 to 14 means the wetting will be there till that from the 9 level to 14 level. In between, you can see the tear will be making the strip as wet. Moderate means the strip will be wet in between 4 to 8, somewhere in between that. And in severe dry cases, the wetting in the strip you can see below 4 only. In that case, we say it as severe dryness. That is the shimmer test. Then other tests, you can see that breakup time. It's like when the eye is held open, the normal tear film lasts more than 20 seconds, and in dry eye, it lasts less than 10 seconds. Then you can have other diagnostic tests like particulate matter in tear film, moves on a mass with blinking, not seen in normal eyes, and debris in the tear margin, which is early sign of dry eye syndrome, rare in normal eyes. Then you can see tear osmolarity, that is increases in dry eye syndrome, corneal filament and mucus plaques, lysozyme assay, and rose Bengal staining. These are the diagnostic tests commonly seen for dryness, and mostly in the OPD basis and all, the test done is shimmer test, which I already explained now. When this condition is left untreated, chronic dry eye may become a progressive disorder. Patients suffering from dry eye disease may move between severity levels and become worse if untreated. Disease management options can be adjusted for individual patients depending on the disease severity. As I told, in the severe dry condition and all, patient will be going on rubbing their eyes, and on a longer period, if this kind of things are being done, there are chances of developing some other eye condition also. One of those being the keratoconus. Now coming to the common management, and before coming to management, we have to see why actually the dryness has occurred. So dryness can be from any extreme, like a person who is continuously using the system. He may have the dryness. And same thing, like as I told, the patient who is having glaucoma and is under anti-glaucoma drops and he is developing dryness, means the treatment for initial symptomatic treatments remains somewhat same. But for the patient with glaucoma kind of disease, we have to look for the that disease aspect also, like what is the exact condition and what is the exact reason for the dryness in that person, and we have to treat it accordingly. Now I will be mentioning the generalized treatments what we can use for the dryness. First, aims of treatment. Aims remains like relief of discomfort, provide smooth optical surface, and prevent structural ocular surface damage. Preservation of existing tears, environmental modification such as humidification, avoidance of wind, dusty or smoky environment, avoid central heating. And here it is like if we are continuously using air condition, or we are continuously traveling in car or vehicles with AC on. For such people also, there are chances of developing some sort of dryness in their life. So that we have to see to it. Lifestyle or workplace modification, taking regular breaks from reading or computer use, especially like the IT workers and all, if they are continuously in front of computer means after some about 45 to 50 minutes, take some 5 to 10 minutes gap. Gap in the sense they have to completely get away from the system. Either they can close their eyes and relax for 5 to 10 minutes. This helps in creating further lubrication inside the eyes and lowering computer monitor below eye level, then increasing blink or fast blinking exercise, discontinuing medications that exacerbate dry eye diseases, and a small lateral tarsorrhaphy used in incomplete lid closure. Now, basically, as I told, these treatments are mentioned for the simple kind of dryness, that is the symptomatic management, what we can generally use. Okay, so if it is an IPD management, means we can first go for Snehabana for 3 to 5 days with Panchatikta Guda. Okay, and we can go till 5 days or till the Sneha Siddha Lakshana. Virechana can be administered with Eranda Taila and Nasya as Pradimarshal Nasya for 3 plus 3 drops or even 4 plus 4 for 5 to 7 days. And after that, maybe we can go for 2 to 3 days Marshal Nasya also. Even Tarpanam kind of treatments are also effective in the dry eye disorders. Then Netradhara is also a very good treatment mentioned for the dryness of eye. We can do it with Triphala Kashayam. Netradhara can be done with Triphala Kashayam. Okay. And nowadays, what we used to practice in our hospital is Akshidavana. That is, you have to prepare the Triphala Kashayam just like we are preparing for Netradhara. So, after properly filtering it with 3 4 layers of cotton cloth, you have to keep it for some time so that it gets cold. After cooling, we can take this kashayam in a spray bottle. Spray bottle means it's a small spray bottle we will be getting in stores and all. We have to fill this kashayam, say about 100 to 200 ml kashayam in this spray bottle, and people who are having this severe dryness condition, they can spray it over the both eyes. So this thing we can do for 4 to 5 times a day, spraying. That is somewhat easy to do by our own rather than the Netradhara kind of treatment. So after preparing the kashayam, have to be kept in spray bottles and have to spray on both the eyes for 4 to 5 times a day. Only thing to be noted is that each day the kashayam should be prepared freshly. And any lubricants is also effective in the dryness condition. Any kind of means our eyes should get some kind of lubrications. Next kind of treatment which can be done in this kind of condition is that Kiriswedam, we will call it as. It's a simple procedure. We have to take some about 5 leaves of tulsi and 5 leaves of this one tamarind and one small piece of haridra. Okay, then all these things have to be boiled in some about 200 ml of water. And after boiling, take out the boiled contents of tulsi, tamarind leaf, and haridra. We have to tie them in a small cloth and do mild fermentation around closed eyelids of both eyes daily once. If the condition is even worse, twice a day is also recommended. And medicine wise, we can give any one of these like Amrudotram Kashayam, Guluchadi Kashayam, Punarnavadi Kashayam, or Manjistadi Kashayam. Normally, what I used to give is that we give a mixture of Amrudotram plus Guluchadi or giving Amrudotram Kashayam in the morning and Guluchadi Kashayam in the evening. The dose remains like have to take 15 ml of Kashayam and 3 times of water, lukewarm water, and twice a day before food. Even you can add Sudarshanam tablet, 1 or 2 Sudarshanam tablets with the Kashayam. Then even Triphala can be given 1 teaspoon twice a day after food. That's also seen as effective. Now coming on to the Pathya Apathya, diet should include plenty of leafy vegetables, chief source of vitamin A, especially palak, coriander, drumstick, amaranthus, carrot, and body should person should be hydrated. Adequate water consumption should be there. So hydration should be there. Adequate water should be taken, and have diets like unpolished rice, whole wheat. Avoid smoking, drinking alcohol, spicy and dry foods. So these are the general Pathya. And even as I told, if the patient is using system for continuously, they can have after 45 minutes of it. Means nowadays it's very difficult to say that we should avoid screen time because maybe our work will be dependent on that also. So after 45 or 50 minutes of the screen, take some 5 to 10 minutes gap. That time even you can wash your eyes with normal water. So these things should be taken care. And the treatments what I mentioned is the very helpful for the symptomatic aspects, especially the kashayam and the tablet and the swedana, which I told with the tulsi leaves, haridra and all. These are found very effective. Here, usually if it's like an IP basis and all, after 7 to 10 days and all, patient used to feel some relaxation to the eyes. Maybe it will not show in the results like what in the shimmer test and all, but overall their discomfort and all, it used to reduce after that time period. So those things can be done. Thank you.
Yes, thank you, Dr. Ashwin. That was a wonderful presentation about dry eye and how it is managed in Ayurveda. Ayurveda way of Samprapti, how dry eye occurs, and what are the doshas involved in the causation of dry eye, and srotas, and how these medicines, whatever medicines you have indicated, what is the logic of making the choice of those medications, Dr. Ashwin?
First, if you are asking about the medications, I can tell mostly not only in the dryness and all kind of shoda kind of diseases, shoda hara chikitsa. If you are going with the trend of this Amrudottaram, Sudarshana, Guluchadi Kashaya, all those things, I have seen wonderful results. Not only in this condition I am seeing, whatever this shoda hara chikitsa if we are seeing, there we can see very good result when we are going with Amrudottaram, Guluchadi, Punarnavadi, such kind of medicines. And regarding the dosha and all, as I told, we cannot tell directly it's based on one dosha because Samprapti depends from disease to disease. As I told, there are many diseases, especially what like glaucoma, all these conditions, different Sampraptis are there. So based on the usage of some medications or based on some disease condition, there is the chance of development of dryness in the eyes. So accordingly, we have to treat the disease also along with this. Okay, so we have to go with for symptomatic aspect as well as the disease aspect. If you are considering about some other condition, as I told, Jogrens and all, for that all overall condition should be improved. Otherwise, the patient will have even more difficulty. Regarding the dryness in the eye, we can go somewhat like this, what I have told. And for further management, we have to see to the disease what the patient is suffering from, whether it is glaucoma or Sjogren's or keratoconjunctivitis, uveitis, anything. So that's also should be taken care of.
So here, logically, it means this dry eye can also manifest as a secondary manifestation of some other disease. The main disease should be treated like Nidanartakara principle we should follow,
Yeah.
and the main disease.
Why I am saying is that, sir, as such, there will be some patients telling that dryness because of usage of system, computer, and all. And for those people, if we are going with the diagnostic tools for, as I told, shimmer and all, in that they will be having a very good result. Means very good, it will be normal only. But still they will be having some irritations and all, which can be easily managed. But there are some other condition because of developing due to some secondary as a secondary factor. In that case, helps as a symptomatic relief. But that is not an end of the story. We have to go with the disease what that patient is suffering from. This will give in those kind of conditions a slight relief only. Basically, we have to go for the disease treatment also, whatever the patient is suffering at that time.
Absolutely, because the main disease will be the root cause of whatever symptoms are manifested, and treating the main disease will solve most of the problems like related conditions which are branched out from the main disease. So that makes logic. And to complete off that question, can you throw some light on Samprapti and also the doshas involved in this condition?
Yes, sir. That's what I was telling. There, Pitta dosha is there. Even some cases we can see the even Vada kind of dosha. That's what. It depends on the kind of problem the patient or the person is having. As like patient to patient, the Samprapti may differ according to the what is the exact reason why he we have to find out why that dryness occurred in that patient. Okay, so we have to go for the detailed history taking. Here, history of the case is very much important. So first we have to detailedly take the history. As I told me, there will be some other genetic factors and all. So history taking is very much important here. Then only we can come to a conclusion. What is the exact cause and reason for dryness in that person?
Absolutely. So telling that the Samprapti also follows the Nidana of the particular disease which is causing the dry eye, and that needs to be taken care of. And you also mentioned about many causes, Nidanas, like Nidana Parivarjana also becomes a very key factor in this particular condition. To isolate those Nidanas, coming to the Samprapti pathogenesis, it depends. If it is a secondary condition, it depends on the main disease, and the Samprapti follows
Absolutely.
that. And if dry eye as such has occurred as a primary manifestation, then Vata or Pitta or in combination may be present. That is right, Dr. Ashwin?
Yes, 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 yes.
What time of the day Nasya should be done and how many times? Kalpana ji asks. And what is the relevance? So where do you see the role of Nasya in handling these disorders?
As already we know, as Nasya is the main treatment for the Urdhva Chaturagata Vikaras, like all the disease which happens, which is occurring above the neck region, the main treatment we can say is that Nasya. Okay, so now if you are asking about the time when to do and all, for if it is like a Pradimarshana kind of Nasya, it's better to do in the early morning. Early morning, some about 6:30, 7 a.m. In that time period, we can do that too. Before taking breakfast and all, we have to do. So, Pradhimarshanasya we can do for about 5 to 7 days. No issues, 3 or 5 or 7 days. That much days we can do. Or else, if it is not possible to do in the early morning, then we should take time like after 4:30 p.m. That time is also advisable for doing the Nasya.
How long do you advise Pratimarsha? If you mentioned Pratimarsha, if it is to be done, how long it should be done? And can it be used as a preventive course for those who have susceptibility of developing dry eye? Like you mentioned, many diseases in which a dry eye may develop in the later condition. For those people, as preventive medicine, can they go with Pratimarshanasya?
I will answer the first question. What you asked, what is the duration? Like, can be done for 5 to 7 days. There is no problem as it is a Pradhimarshana kind of Nasya. And for prevention aspect, we cannot tell that Nasya will be as much effective for the prevention of the dryness. Okay, because the external factors, whatever happening, sometimes that will be unavoidable. So, but overall, there will be some changes if you are going with Pradimarshan Nasya. And one more thing I have to suggest is that we can go for the sac massage. Sac massage is the one kind of eye exercise which we can do for the dryness condition. Okay, here what you have to do is that near to the inner canthus of both the eyes. Okay, for a layman, I can tell it as like the point where the eye is about to start. Well, if they are just touching there, we can feel one small point-like structure there. Okay, so with the both the fingers, index fingers of both the hand, you have to just gently press over that position and do mild massage like this. It can be done in a clockwise rotation and anti-clockwise direction. 3 to 4 times you have to do at this steps. Then you can take your hands. Then again go on doing that one. So whenever we are having that free time, especially the people who are continuously using system and all, you can go on doing this sac massage. It is very effective also. Why we are doing at this point means it will help to loosen the tear glands and all. So when you are pressing with a little pressure, you can feel like sometimes mild wetting inside your eyes. But that is a good. So frequently, if you when I will not tell it once or twice in a day, frequently when you have that time, you can go on doing this massage. We call it as a sac massage, and that is very effective also.
Okay, thank you there. So that was an important tip for dry eye. So the sac massage is really, I think, easier to do also. I think even the sterility of the hand should be taken care of, like wash your hands before
Yeah,
doing. So all those precautions need to be taken. Seeing those things, as you said, Pratimarsha cannot be as such used as a preventive measure, but
yeah.
in combination with the Netra Tarpanam and other things, can we use it as a preventive measure? So for those people, I am not asking. Still, we may suspect that these people might get dry eye in future. In such conditions, if you are suspecting that these people are suffering from this and this diseases in which dry eye can occur later, or they are taking medications in which dry eye can occur in later time, why to wait for that? So if we are suspecting
In
that,
that condition, yeah, in that condition, sir, it's not necessary to do a complete day like for 7 days in a week and all. At least 2 or 3 times in a week will be necessary for that aspect. And next thing is that usage of some lubricants inside the eyes. Okay, especially people who are using too much time for the screen time and all. And even that earlier I mentioned about that Triphala Kashayam getting filled in the spray bottle and spray. So one more thing what we can do is that instead of this Kashayam, those who have this dryness problem, that lubricant drops, that can, even that 1 or 2 small bottles, you can empty that bottles into the spray bottle. Then you can go on spray 3 or 4 times in a day. It will have a very good effect.
spray of kashayam should be done with open or closed eyes. This would be the doubt of many people, whether the spray should be
Yeah.
done with open eye or closed eye.
We can do it in open eye itself, no issues. Only thing is that if it is a kashayam means you have to filter it properly. That is the only thing to be noted. If it is properly filtered means even in open eye it's okay.
But
Otherwise,
how to monitor the pressure? How to monitor the pressure while spraying?
yeah, it should not be too much big spray bottle because the force will be more. So it will be somewhat this size. Okay, and you have to keep it some about 5 to 6 centimeter from your eyes, not too much close. You can just keep 5 to 6 centimeter away from your eyes, and you can go on spray. So
In
at a stretch, spray 3 to 4 times in one eye, same like that in the other eye also. So overall, in a day, 4 to 5 times also we can do.
initially, the patient might require little bit of training to do that.
Not needed. Only thing is that the too much pressure should not be there. That's why I told small spray bottles. Even if it is like a big kind of spray bottle, means it will be having too much pressure
Pressure.
once we are spraying. So that will be coming too fast. That is misty spray. We used to say that it should be like mist. It
Okay.
should come like that.
And I have a doubt that what is the role of Virechana in this context actually? You have mentioned the beginning, Snehana and Virechana has been given. What is
That's
the role
because
in that context?
even because it's like creating a dryness in the body. So for that purpose, if we are making the patient to take some snehana and giving like after attaining the proper sneha with the lakshana, if we are going for virejana means that kind of some betterment the patient will be feeling even after snehana also snehapana. Even after Snehapana, after attaining the proper Sneha Siddha Lakshana, if we are doing the Virejana for those kind of patients who are having dryness, they feel
Snehapana is okay for dryness, it is good. But in Virechana, it is go for Pitta, no? Here already Rukshata is increased, means Vata is increased in this context maximally.
but overall, we gave some 5 7 days Snehavana. So then it's
Yeah.
better to have that eliminated also. Means once the Snehavana is done for that much days, it's like after that, if we are going for that without this, means the patient will have even more difficulty. So after Snehavana, it's better always to have that Virejana.
So
Can we?
if we can go for Basti, Sneha Bastis to make Snehana of the
Uh,
body.
that also can be done, but that much because even in the dryness, as I told, maybe that will be contraindication some of the eye conditions, bastis and all. So that we have to properly taken care of
And
because in
another line
some
of
Especially so in the eye disorders wherein pressure monitoring should be done.
yeah,
So there we need to look
yes,
out
yes.
for the treatments.
There we can't go for this those kind of treatments.
so another line of treatment that the Putapaka is can done no? Rather than using the gratas and that the if Putapaka has been prepared directly with the mamsa and it is give better nourishment compared to the gratas and all. Rather than
Yeah, that
Tarpana,
can
Putapaka can be done.
Yeah, that also can be done. What we follow here is like first we will be going for 5 or 7 days tarpana, and the last day we will be addressing the patients Uttaraga. And that is also not like mandatory. In some cases only that will be advised.
Maybe in which conditions you are going to more preferably for Putapaka?
If there will be some conditions where the patients will be having high IOP, intraocular pressure, as I told in glaucoma and all. In those conditions, mostly we won't be going even for Tarpana also.
Because of the pressure. Here, related to Karim sir's question, can we take up like Virechana should be the option where Pitta involvement is more? Because eye is one of the seat of Pitta, like Allergic Pitta. So taking that logic and also Pitta predominant symptoms are seen, then logically we will take Virechana into consideration. Otherwise, no. Is it? Can we do?
Yes, sir. We can logically take in that sense also.
Hmm.
Like as there is an involvement of Pitta, we can go for the Virechana.
And Snigdha Virechana is also beneficial for Vata conditions because when we're speaking about dry eye, so Vata involvement is invariable. So we know that the eye always has a threat from Kapha. So here, if we can take the moistness is reducing, the Kapha elements are reducing, obviously Vata elements will be increasing. So in that condition, generally it may be a reflection of the gross dryness inside the body, and Snigdha Virechana probably acts in that particular way, like controlling Vata and also the overall dryness in the body and also the effect of that over the eye. Okay, thank you there. In LASIK patients, can we use Triphala Gruta? Please guide something for computer eye syndrome.
Yeah, classic patients, we can use Triphala, especially like dosage being 1 teaspoon twice a day is advisable. No problem for that. Even they are undergone this one LASIK kind of treatments also, they can take the Triphala. Next, for the second question was related to the system usage. There, as I already mentioned, first thing what we have to note is that for some people it will be like we cannot avoid the system because their work will be basically in that also. So there, like as I told, after some 45 or 15 minutes of usage of screen, try to take 5 to 10 minutes gap from that. Okay, and if possible, if fresh water is available, means you can rinse your both eyes with that. Then, as I told, the sac massage can be done in that time period also. Just 3-4 times you have to do that one. Then next thing is that general eye exercise can also be done. That helps in the improving the circulation and all. It's very simple one. Like you have to see up and down 10 times without moving your head. Okay, see up and down 10 times without moving the head. Then left, right 10 times. Then complete rotation of the eyeballs. Clockwise direction 10 times and anti-clockwise direction 10 times. These exercises can be done. On a regular basis also, this can be done. Like by taking 15 to 20 minutes. So basically, the sac massage can be done, eye exercise can be done, and even taking some gap, some off time from the system.
And then one more question is why Sudarshana Vati? Why it should be used?
Basically, what we always think is that when it is like Amrudotra or Sudarshana giving, there will be many eyebrows raised, like that is mentioned in Jwara Chikitsa or something like that. Why we are giving in this condition? But usually, from my experience for the last 4 to 5 years, I have, whenever the condition means mostly we are seeing here only eye-related conditions. So even in the macular edema conditions. So if you are going with this Amrudottara, Guluchyadi, Punarnavadi, along with the Sudarshana tablet, even after 1 month time, we used to see some very good results. When the patient is experiencing that relief. Even once I mentioned to Raghuram sir earlier, I don't know whether he's remembering or not, because that combination, right from the beginning, I am giving for the Shoda conditions in the eyes, inflammatory condition, and it's giving very good results also. So, if possible, my advice is that if possible, you can also try these things in the Shoda conditions. It will definitely have a very good impact also. Where even when you are giving 2 tablets along with the kashayam powdered, it is having that effect.
So Sudarshana Vati, we know Sudarshana, it has wide spectrum of action and should it be powdered and mixed in kashayam? That is what you're telling?
Yeah, it's better is that it should be powdered and mixed with kashayam.
Mixed with kashayam. Well, what is Meibomian gland role in this condition?
It's like sebaceous glands. Okay, sebaceous glands. This Meibomian glands are the sebaceous glands and with the tubulo-acinar structure. Okay, so what happens means especially it's not like that every time there will be involvement of Meibomian gland. Okay, as I told, there are involvement of some other factors as like for the lid margin, something it will be related with the lid margin. Sometimes it will be with the kind of like, for example, in the inflammation of the eyelids. Okay, blepharitis condition, kind of condition. So even it's like rarely we are seeing, but due to some of the malfunctioning in the of the Meibomian glands, we can see the dryness getting occurred. So when we are going for that test purpose and all, when we are seeing those things, we got that idea that it's also in some cases it's also related with the dryness which is produced in the eyes.
Sometimes, as you said, it may be a part of autoimmune disorder like our dry eye. Kalpanaji's question was, what if it is an autoimmune condition or a part of autoimmune condition? What to do?
If it is a part of autoimmune condition, first thing we can do at like symptomatic treatments only in those kind of condition, as it is an autoimmune, we know. So what is the exact disease, that also should be taken care side by side. This will not treat the patient completely in those kind of conditions, but overall that will help them reduce their discomfort, what they are feeling related with the dryness inside the eyes. But as such, it is not a complete cure for autoimmune diseases.
One more question is, Dr. Ashwin, can we apply triphalagrutam externally and internally on eye? So your take on applying it externally, internally, or both?
One thing, we can take it internally, like as I mentioned. Next, we can apply it externally. Externally, like Netra Abhyanga, we can do. Take 1 or 2 drops of the Triphala Gruda and close your eyes and just have a circular massage, like 7-8 times in the clockwise direction and 7-8 times anti-clockwise direction on the both the eyes. At night time, it will be better. That also we can do, external application over the eyes.
Like seasonal allergies causes lot of irritation and dry eye condition with constant feeling of rubbing eyes. The question here is related to the seasonal allergies. Will Triphala Kashayam, can it be suggested in this case, or do you suggest some other medicines and remedies?
Triphala Kashayam is suggested. Next, can go for Haridra Kandam. Haridra Kandam can be taken internally. That is also effective in this kind of condition, seasonal kind of allergies. Even Triphala Kashayam eye wash can be done. Then some lubricant drops can be used in such kind of conditions.
Moving on to the next question. Some of the teenage kids, now we'll come to teenage kids who have seen kind of discomfort in eye and secretions. Is there any readily available eye drops which helps in this? There won't be any other disease associated except the excess screen time. See, the cause is screen time, excess screen time, no other causes, no other diseases. But the kids who are exposed to excessive screen time, they are having discomfort in eye and secretions. For this condition, do we have ready-made drops which you can advise?
Ready-made, it's like all the lubricant eye drops can be used. For us, if you are asking me, means we are having here like Sunetra kind of eye drops, eye plus. These are the normal lubricant drops which we are using in our hospital. Like that, likewise, different pharmacies or different Ayurvedic hospitals itself, they are having their own lubricant drops which are helpful in these kind of conditions. So it's like some lubricant drops can be used in those kind of conditions. One. Next, if it is a kid, means they can have a regular eye exercises daily for 15 to 20 minutes time. And even for an exercise purpose, outdoor games are more advisable rather than sitting indoor, because these helps in, because nowadays we are seeing more cases of myopia in children and all. Earlier it will be like some hereditary, maybe parents are using and all. Now it's not like that. Even especially after that post-COVID time, after using long time for system and all, mostly many kids are having this kind of myopic issues and all. So if it is not a myopia, general allergic problems, means you can use any lubricant drops.
So the biggest problem and the challenge is how to keep the kids away from the screen and the screen time. So that Nidana Parivajana is the biggest challenge for any parents. Lubricant eye drops, as you said, so are they available in market? So there are some customized that Sridhari I can understand.
Yeah, even Himalaya have their drops.
So they can be used.
Mostly every pharmacy is having producing nowadays lubricant drops.
Would you advise that they should be taken in consultation with the doctor and not just purchase and use it?
Yeah, that will be
That's
better.
right. That will be really better. Okay, so one more question here is: can applying Triphala just externally, only externally, will it help? So only external application, we are not doing anything. Just applying the Triphala the question is not internally or externally. Yeah, it is externally, very specifically. So we apply Triphala externally on the eye. Will it help? If it helps, to what extent?
Yeah, we cannot tell it that completely that kind of problems will be gone with just applying externally, because it is somewhat serious kind of dryness and all. There should be some things given inside also. Just applying Triphala or putting some drops is not enough. Like in the starting stage of some mild kind of dryness means it's enough. In that kind of conditions, it's enough.
Yeah, sir. Can we use Triphala external massage for dry circles around eyes too? This is little out of syllabus for our topic, but still you can take it as an eye expert. So for dry circles around the eyes.
Yeah, because we can use that one, but to what extent that gets cured is a question. Because right now I haven't seen anyone using that one for the dry circles. So regarding the action of that, I'm not able to say right now.
How kashayas act in this condition, like dry eye? Abdul Karim sir's question again.
It's like basically, as I told earlier, sir, just something, just if you are using externally itself is not enough. Okay, so some medicines should be given inside also in the. And I will say one more thing. If it is like a initial stage of dryness, just because of the some system usage and all, there it's not necessary that we should take some internal medication. There we can go for the lubricant drops or some kind of eye massage, those things. But when it is like severe dryness, when the patient is having severe sort of dryness, then it is almost is always better to give something internally also, both external as well as internally also. Okay, something supplement should be added there. So that's the reason why we have to give some medicines internally. It's not always necessary that you have to give kashayam, but some, or else even if you are giving such tablets, that is also enough. Just external application is not necessary in those kind of cases. We have to give something internally to the patient also.
Maybe to combat with the doshas and the dhatus and other things like supportive, if we need to give brahmana kashayams or something to pacify the doshas, there it comes in handy. Will it be in the preliminary line of treatment, like initial approach, or we can like continue using kashayams?
We can continue using that one. And once those discomforts are reduced to some level, means we can stop internal medications. Then we can go with the external thing.
So here a comprehensive approach is very important, like internal medicines, external medicines, lifestyle changes, everything. So they act. It's not just a kashayam or a tablet which acts. Okay.
Yeah.
So for how long can we use the lubricant drops? Shishirekaji asks. How long?
If also like normal tear drops means if you are continuously using, also no issues with that. We are continuously using, like we are from morning till night, we are in front of the system and all. Those kind of persons, if they are continuously using some normal lubricant drops, means it's not an issue. There is no problems with that.
Again, the doctor would be the best person to advise that. Whether you prepare fresh and give it to the patient, or advise daily prepare, and or do you advise them to prepare, whether you're preparing the fresh kashayams and giving? I think it is related to kashayam only, or would you advise them to prepare?
We will advise them to prepare, because if it is in the hospital, like as I told, for IPD daily basis is prepared correctly and given to the patient. But when they are going to their respective home, or it is an home.
And Victoria ji's question is moringa good for dry eyes? Have any idea? Moringa, like our shigru, is good for dry eyes?
Moringa is usually good for glaucoma kind of condition. Glaucoma. It helps to reduce the eye pressure. Okay. And even moringa leaves can be kept over the eyes and can be done bandage, what we call as pushpa bandhana. But it's not directly having benefit for this purpose, dryness and all. That you can, for the leaves means you can use tulsi leaves or this one, tamarind leaf. That is beneficial. Moringa is used especially in the eye pressure increase condition.
Okay, thank you there, Dr. Ashwin. And
So my question is, a lot of us travel from the US to India, and it's a very long flight, and often we carry some Visine or something with us. Eyes get dry very fast in the aircraft. So is there anything you can recommend that we can use for that, for journeys, for travels?
If it's a long hour journey, especially in flights and all, it's always better to keep some lubricant eye drops with you. Okay, because whatever methods and all what I mentioned earlier, those things will be very difficult to do especially when you are in flight and all. So better have consult with one ophthalmologist and try to keep some of the normal lubricants, at least one lubricant with means in your hand, so that you can use those things when you feel such kind of irritations inside your eyes.
thank you so much, Dr. Ashwin. Namaste until we meet next time. Namaste.